Okay, great. Welcome, everybody. My name is Angermayer. I have the huge pleasure to interview my colleague. So we started a company together, Cambrian Biopharma, about, the title says actually the science of aging. Hopefully, it's more the science of not aging, because that's what it's all about. But meaning first, maybe big question is, because it's such a broad topic, and some people think we're going to talk about supplements, some people about drug development. What is it for you, or what are we actually even talking about when we talk about the science of longevity and aging?
Yeah, so I've been following this field for about 20 years, first as an enthusiast, and then as an active researcher, and now running a business in this space. And I think where the real progress is coming from in the near term is the creation of new drugs that would be regulatory approved drugs that will do something quite special. They will be multi-disease preventatives. So something that we could take like an everyday pill to slow down the risk of cancer, heart disease, bone weakness, muscle weakness, all at the same time. And there's actually a drug kind of like this already on the market now, and those are the statins, right? So drugs like Lipitor that many of you might be familiar with. These are drugs that we take now that have been shown to reduce risks of heart attack and stroke. And so imagine with the new science of aging and longevity, we've been able to take that kind of schema, which works as an investment thesis, and extend it out to drugs that don't just hit the cardiovascular system, but actually would hit the neurodegenerative diseases, cancer, and frailty as well.
Where are we in this sort of exciting journey? Are these drugs happening tomorrow, 20 years from now? Like, what's the time frame?
Yeah, so this whole field has been exploding over the last few years since you and I created Cambrian, which is, I guess, now one of the larger companies in this field. So we've got close to 20 drugs in development under the Cambrian umbrella, all targeted at the different, what we call drivers of aging. The first of these drugs are entering phase 2 human clinical trials, but not for aging, right? Because aging is not a disease that we can go run trials for, at least not yet. So each of the drugs underneath Cambrian are being tested first as drugs for individual diseases. And then after we show that those drugs are safe and effective, then we'll be testing them for what we call multi-disease prevention. So realistically, by the time that the US gets around to this, we're talking about late 2020s to early 2030s for the first approvals of these kind of drugs. And elsewhere in the world, it may be even sooner. It depends a little bit on how some of these other jurisdictions think of the regulatory path for aging drugs.
What is the investment case? Obviously, Cambrian is a sort of professional, for-profit biotech company. Is it like harder to develop longevity drugs than a normal cancer drug? Is it easier? Will it make more money, less money?
Yeah, so I think the investment case sits in two different buckets, right? The first bucket is what would it mean to create a drug that actually slows aging, right? Such a drug would almost certainly be the best-selling medicine of all time. But it's going to take us a little while to get there. So the breakthrough that this longevity space has gone through in the past 4 or 5 years has been the realization that if you can create a drug that targets one of these mechanistic drivers of aging, right? One of the things that goes wrong with us on the cellular and molecular level that causes our bodies to break down, that drug might be able to extend lifespan in a mouse by 30%. But it's also probably able to fix at least one human disease where that particular mechanism, that piece that's going wrong with us as we age, is particularly out of whack, right? As an example, to bring this to life a little bit, with cancer biology, we know cancer is caused by progressive buildup of DNA mutations. And so if you create a drug that can slow down the rate of DNA mutations or enhance DNA repair, that can make a mouse live longer, but it may also serve as a great cancer preventive.
So practically, like in a good way, like longevity drugs almost have two use cases. You have an immediate use case because you actually need it, as you said, because aging in itself is not a disease, and you can approve, and you will make money by developing a great cancer drug or a great heart prevention drug. And then additionally, you practically have how I always say, like a total addressable market of 100% of the world population, because if it's additionally slowing down aging per se, everybody will take it.
That's right. And in fact, the way that we've constructed Cambrian as a for-profit company, we set that whole aging investment thesis to a value of 0. Right? And we value Cambrian and each of the investments we make on individual drug products based only on how they fit within the existing pharma market, which is about $1.2 trillion a year, and then say, hey, look, what age-related disease or even specific type of cancer, specific type of heart disease, or a rare disease where these mechanisms are out of whack, where can we use these drugs first to show safety and efficacy? And the more data you have on safety and efficacy of these drugs, the more de-risked they are to say, well, hey, maybe we could then run a trial where you take the drug and I take the placebo and we see if it actually works.
A little bit more philosophical, but like some people instinctively say, first of all, is aging not naturally, and is it not sort of something we all should do? Then some people say, oh, aren't there not enough people already on the planet? Like, doesn't it make things worse? Or then the very pragmatic questions like, how will society look like if we live longer? Like, what is your thinking around sort of more the philosophical questions? Shall we actually slow down aging? And maybe even shall we sort of avoid dying somewhere?
So, unsurprisingly, as you know, Christian, I spend a lot of time talking to people about the biology of aging and the science of longevity, and I find that every person who isn't on board with doing this already has one of 5 objections that they have, and they almost go in like a linear order, right? And so I like to describe it that people come in anywhere along these 5 spots. It's either, this isn't natural, so we shouldn't do it. Okay, it's not that bad. It's part of similar to other human technologies. We should do it, but it'll never work. Okay, it will work, but you can't run clinical trials. Okay, you can run clinical trials, but then when it's approved, it will only be for the rich. And then if it's not only for the rich, it's going to destroy society somehow. And I think that there's really great conversations to be had about all of those 5 things. You actually just touched on 3 of them, right? The why do it overall part of it, I think I come to this from a perspective of saying that more years spent in good health is almost like an axiomatic good. And we work with some lobbying firms in DC, and they actually did an interesting experiment where we had PPP, the big polling agency, do a big survey of people. And on one hand, they asked, oh, would you be in favor of a pill that slows down aging? And about half of all people were in favor of that, which was actually higher than I expected.
I wonder what the other half, but like that's like deeply concerning.
But the interesting thing is, scientifically, a pill that slows down aging is the same as a pill that prevents Alzheimer's disease and frailty and stroke and all of these things. And so if you just ask that question directly, would you be in favor of developing a medicine that reduces your risk of getting Alzheimer's disease and cancer and heart disease? All of a sudden, it's more than 85% of people say yes. And the real question I have is, like, what about the 15%?
What about the 15%, like, deeply misanthropic?
But I think that the way that we approach it anyway, for that first, like, should we even be doing this, is that it is an axiomatic good in the medical world to give people more time with their loved ones, more extra years of good health. And the whole field has oriented not around this idea of lifespan, how many years will you live until you die, but instead around this idea of health span, right? How do we maximize the number of healthy years that people have? Because right now, especially in the past 30 years, we have this troubling situation where our lifespan is extending faster than our health span, and we're spending more unhealthy years on average at the end of our lives.
Do you think that there will be a point in the future where we live forever, or at least, let's say, forever is the wrong term because there's always a statistical thing happening somewhere, but like in a way that it feels like, okay, this is like not like going life expectancy from 85 to 90, but maybe to 150. Some really like something which feels for us here like almost like forever.
So it's unlikely that the first interventions are going to flip a switch and have us, be living on average 80-year lifespans and go to 150. What we see in mice, which are the animal models that we use to test whether these drugs can actually
I
extend.
was jokingly saying it's the best time to be a mouse at the moment because there we know everything. Like, yeah, so they live longer, they're more healthy. Like, yeah, we just need to
The
translate
mice
it
are
now.
extremely happy with all of the work we're doing. But we use mice as like a sort of bellwether of how these drugs will perform in mammals. And in mice, we have now close to 80 drugs that extend lifespan up to a maximum of about 40%. We don't think that those drugs will work as well in humans as they work in mice. Mice live on average 2 to 3 years, right? So you can extend them, 4 or 5 years. Humans live on average 80 years now. But there's this interesting thing that, like, even if we have just a fraction, let's take that 40%, right? Even if we just get a fraction of the benefit, a 5% gain in healthy years for humans, that's like a 4-year boost, right? 80 to 84, something like this. That is actually a massive improvement. Just to give, again, just like running through the statistics, and I don't want to bore the audience here, but if we were able to create a pill that cured cancer, so that no one ever got sick of cancer and ever died of cancer before, do you know how much human lifespan would be improved? It's not that much. It's actually only about 3 years. So one of these drugs could, even if it just did, 1/10 of what it does in mice, would be better statistically than a cure for cancer, which we're nowhere close to. So looping then back around to your overall question, and sorry for going down a bit of a rabbit hole here, as we move from these first drugs that we're talking about 5 or 10 years of extra healthy life from maybe just one drug, we may get into a very interesting situation that I call progressive prevention, which is if you buy everyone in this room an extra 5 or 10 years of healthy life, then all of a sudden you've got another 5 or 10 years to create new innovations that will be the next step and the next step. And we actually saw this happen not too long ago, starting in the 1990s and moving into actually up to present day with HIV preventatives. Right? If you look at folks like Magic Johnson, who got HIV in the early 90s, when he was diagnosed, HIV was a death sentence. But the first drugs started to come out, and those promised people a little bit of extra time, and that gave enough time for the next generation of drugs and the next generation of drugs and combinations of those drugs to actually have people who were diagnosed when HIV was a death sentence still be alive today. And now we're almost at that point with HIV that you talked about with longevity, where you can live a normal life where the disease is not a dramatic negative impact on your overall lifespan. I want the same thing to happen with diseases like cancer, Alzheimer's disease, and heart disease.
Why do you think there was so little progress so far in cancer? Because this is one of the overarching things. And do you think the whole longevity community can contribute to finally solving it?
Cancer is a bitch of a disease. It's actually what brought me into science in the first place. My grandfather was diagnosed with cancer when I was a teenager. It made me want to become a scientist. I studied oncology for my PhD. And the challenge with cancer is that by the time we detect it, it is already this almost evolving beast inside of our bodies, where whatever we do to try to pull it out with surgery or give some kind of new treatment to it, as long as one cell out of the billion that were part of that cancer figured out a way to evolve around that treatment, the cancer will come back and eventually kill us. So I think that the solution, if I can use those words, to cancer, where we've made the most progress on it since we declared war on cancer under the Nixon administration in the 1970s, has been to think about the disease at earlier and earlier stages, right? And so there's a whole arm of science right now that is getting better at detecting cancer at stage 1 instead of only at stage 4. And then there's a whole nother arm that I think is really being spearheaded within this longevity community of thinking about how we could build preventatives for cancer. I mentioned before the idea of using enhanced DNA repair, but there are actually a whole series of hypotheses, about a half dozen, that could be cancer preventatives, including taking better care of how our metabolism works, taking better care of how our what are called senescent cells that try to undergo what's called apoptosis, or a programmed cell death, trying to get these cells to actually kill themselves instead of hanging around and accumulating DNA mutations and potentially eventually becoming cancer. So there's a whole series of interesting things coming out of the longevity space here, as well as the diagnostics field, that I think are making slow, gradual progress towards better and better cancer treatments. And then people working just in oncology are also creating new innovations that we're getting better and better, but it's very marginal, right? The average cancer drug, and again, sorry for just dumping so many statistics, but the average cancer drug that was approved in the past 15 years improves the outcome of patients by only about 3 months, which is a kind of depressing statistic overall.
Okay, let's go to something more positive, like a quick one, because I have a very important last question. Like, why the name Cambrian?
So we actually named the company Cambrian for 2 reasons. One, as I mentioned before, is we've got a lot of programs under our umbrella, and we knew that, you and I couldn't sit up in an office somewhere and say, this is the drug that's going to slow aging. We knew that we were going to have to take a lot of different shots on goal. And one of the times in evolutionary history that this happened most profoundly was during the Cambrian explosion, which happened about 500 million years ago, right? So this is a period of geological time where, in a very short window, there was this immense amount of exploration. And you see the most weird creatures kind of come into being around the Cambrian era because they would just try all sorts of different new ideas. And the end result of that was we got eyes, legs, bilateral symmetry, skeletons, all of these things out of that very short period of innovation. And so we kind of wanted to model that spirit of exploration in the company that we came together with. The second reason that I also love is that there's this great quote in evolutionary biology that you have to go quite a long way in evolution before you find the first bona fide corpse. We're brought up and programmed and socialized to think about aging and dying as such a natural part of who we are. But as you look back on evolutionary history, about the first 3 billion years of life didn't have aging as we think about it today. Aging is this consequence of creating ever more elaborate shells around the immortal cells that are actually passed on from generation to generation to generation. And I think that using that as a reminder of like, hey, this aging thing, it's a consequence of evolution, but it's not a part of being alive, is an interesting philosophical concept.
So last question, which is normally the one people are most interested in, because you perfectly described sort of this rat race, like, okay, there won't be a drug which makes us live forever or very long tomorrow, but like, yeah, we gradually gonna push life expectancy so that, yeah, like you described perfectly, which happened to HIV patients. So how do we make sure, like, I would always tell my godchildren, they're 12, I was like, okay, you're easy, yeah, but I'm sort of in the middle, like around 40, like sort of, I need to make sure that I'm still there when sort of the really cool drugs, hopefully developed by Cambrian, are hitting the market. So what are very practical things, aside of the drugs we're developing, because they're obviously not on the market, what are very practical things which everybody here can do right now to sort of increase the probability that they are still there when the real stuff is hitting the market?
So I would say there's the big 4 that everyone should be aware of and trying to practice in their everyday life that are easy conceptually, hard when you get down to it, right? And that is eat right, sleep well, get regular exercise, and have a community. And so sleep, this is like 7 to 8 hours a night of good deep rest, ideally going to bed at the same time almost every night. From a diet perspective, like I'm not a crazy evangelist about any particular diet, but the idea of like mostly conforming to a Mediterranean diet, being moderate on alcohol consumption and not eating too much sugar, passing on dessert more than you say yes to it, these type of things seem to correlate with better health. And then exercising, which doesn't need to be like running marathons, but like getting your heart rate up 3 to 5 times a week. You put those 3 things together and you're talking about, between 5 and 10 years of extra health span gains over the average for any given person. So
what's the 4th? Community.
And the 4th is community, which is one that I think is often forgotten, especially by scientists. But as we go around and look at what are called the blue zones, right? Places where people frequently live above 100, one of the unifying factors of all of those different blue zones, and there aren't a lot of unifying factors is this sense of multi-generational community, that people wake up and they have a purpose and like a meaning, so that when they go about their day, they feel like they are a valued part of a society, that they have people they want to interact with, things that they want to do. And as soon as that sense of community or sense of purpose goes, the person goes very quickly afterwards.
Interesting. So have friends, go out with friends for dinner. Thank you very much. I think this was very optimistic, and I'm very optimistic that we're going to succeed. Thank you all for listening, and see you soon. Thank you. Bye-bye.
Yeah.